What is insight after a bipolar psychotic episode? Imagine waking up from a confusing dream and trying to make sense of what just happened. That's similar to what insight after a bipolar psychotic episode feels like. Insight is your awareness and understanding of your mental health condition, especially recognizing that you experience psychotic symptoms like hallucinations or delusions. During a severe episode, which can happen in mania or depression, your mind might be overwhelmed, and your awareness of what's real can be distorted. You might not realize that your experiences are linked to bipolar disorder or understand how your behavior is affected. This is called poor or absent insight, and it's common during the height of a psychotic episode. As treatment kicks in and symptoms start to improve, insight usually begins to grow. When a person stabilizes and recovers, they often become more aware of their condition. They might recognize that they had a psychotic episode and understand how it impacted their life. This awareness helps them see the importance of ongoing treatment, like medication and therapy, to prevent future episodes. However, the level of insight can vary from person to person. Some might fully understand their illness, while others might only have partial awareness or fluctuate in their understanding over time. Factors like brain function and how severe the illness is can influence this. Gaining insight after a psychotic episode is really important because it's linked to better treatment adherence and healthier coping strategies. When individuals understand their condition, they're more likely to follow their treatment plans and recognize early warning signs of relapse. Psychosocial support and education can help strengthen this understanding by explaining the nature of bipolar disorder and how to manage it effectively. But it's also important to remember that coming to terms with having a mental illness can sometimes bring emotional distress or lower self-esteem. Support from healthcare providers can help balance the development of insight with emotional well-being. In essence, insight after a bipolar psychotic episode is a dynamic process. It starts from little or no awareness during the episode and gradually evolves into a clearer understanding as the person recovers. This evolving awareness is vital for managing bipolar disorder long-term and improving quality of life. Remember, everyone's experience is unique, and ongoing support from mental health professionals is key to fostering insight and resilience. If you or someone you know is navigating this process, consulting a healthcare provider is always the best step for personalized guidance and care.